Boom. And we're going. And so I know we don't have a lot of time. We got about an hour because you got to get to the airport. But how I like to run the show, especially because this is your first time of many, it sounds like, just introduce yourself, who you are, what you're about. And then I think, like we said today, we would like to go over the different treatments that you have developed and that you offer, some of the stuff you just did with me. And then we will, as you are kind of building your clinic into where we can actually facilitate treatment, we'll do a follow-on to be able to direct people more specifically.
Okay.
But just kind of a blanket overview of really taking medicine in the new direction of healing the actual root cause of issues, as opposed to what everybody's been subjected to our whole lives of just perpetual sickness.
I think the easiest way to have everybody see things from, I guess, my point of view of how I became the kind of physician that I am, was even from the first week of medical school. I remembered hearing a pharmacologic lecture on what they call nuisance criteria in pharmacological research. Nuisance criteria is basically a way or another word for the placebo effect. So they consider the placebo effect to interfere with up to 20% of every single drug trial done. So when I first heard that, I raised my hand up in class and I said, so you mean if there's 100 people with high blood pressure and you give 100 of them a sugar pill, but you tell them it's a low blood pressure pill, 20 of those people will have low blood pressure? Yes. Interesting. So we were talking a little bit further and I raised my hand up again. I go, cancer, chemotherapy, radiation. If there is actually a chemotherapeutic agent that you can call a sugar pill, call that a chemotherapeutic agent, 20% of that cancer will go away. Yes. So my last question was, what drug do we know of that'll cure 20% of all disease? And why aren't we just studying that? I basically was laughed out of the class. That's not moral. That is tricking people. And all I kept thinking is, if somebody's paying me $50 to make them better, and I can trick them into being better, how is that wrong? So I further got into it, and the biggest question that I had too was, well, we're being taught to give aspirin for a headache. Are we really deficient in aspirin when we have a headache? No. We're dehydrated, we have depression, you haven't slept right, there's a million reasons why, but yet we choose to give an aspirin. So I laugh and I go, well, we take better care of our cars than we do of ourselves. So if you go to a mechanic and you say, I got this red oil light that's flashing and it's bothering me, analogous to pain. The mechanic, if he reaches over and pulls a circular piece of black tape out and says, put that over your oil light, no problem, we got you covered. Well, wait, aren't you going to check under my hood? Like everybody thinks that, well, that's wrong, but that's what we do to ourselves when we walk in and say, hey, I'm in pain, give me a pain pill. Well, you're in pain because you sit 8 hours a day for your job, which isn't natural. You eat crappy foods, which isn't good for you, natural, everything about it. You think you're taking vitamins, and all of that is a fallacy. We give cyanocobalamin and call it B12. And this is another angle. There's probably a whole full podcast of how, I would say, nefarious the research medical industry is. And the fact that if you go into a doctor's office now and you ask for B12, you'll get cyanocobalamin, and that in no way whatsoever is anything resembling B12 in your body. Cyanide creates a triple covalent bond with cobalamin. There isn't an energy in your body that can break a triple covalent bond. We break hydrogen bonds, methylated things. We have easy energy sources, little, basically, if you understand organic chemistry, a single hydrogen-oxygen bond is a lot easier to break than a triple carbon bond, okay? So cyanide and cyanocobalamin, you take that and they call it B12, but you pee it out in exactly the same form, and it is so stable that it's cheaper now to isolate sewage and give you B12 from the sewage than it is to make it. So all of the energy drinks that you drink with B12, if it says cyanocobalamin, you're drinking sterilized sewage.
I've heard people say that before.
Flat and simple. So getting to
So stay off the Monster Energy drinks.
I tell you what, and anything with sucralose in it, all of that. You're just inviting, and they hide it in energy healthy stuff.
Wow.
So I almost believe that you can't get anything that's labeled healthy without some zinger being thrown into it.
You know, an interesting thing, like you said, about putting the black tape over the oil gauge. Mm-hmm. You know, we talked about it yesterday, like in the military, anytime something hurts, a cortisone shot.
Yeah.
So there's your black tape, right? But not only are you hiding the symptoms, but they're finding I would guess 99% of the time you do that, you're actually not only kicking the can down the road, but they have their own host of side effects as well. So you're actually giving your body more issues to deal with.
100%. The reason that cortisol works is because it instantly retards your immune system. It makes it like it has no idea what's going on. So you're not bothered that it hurts you. Motrin doesn't stop inflammation.
800 milligram Motrins were Rangers, they call it Ranger candy.
It stops the production of a chemical to be cleaved that makes you aware of your pain, but the entire process is still going on. So the one thing is about Motrin, Tylenols, they actually make you feel better, and I actually think you heal faster because you're happier.
I see.
It's kind of weird, but there is a way to vibe above disease.
Okay.
And I find that through prayer, through doing good deeds, all kinds of, because God has got to be in the middle of everything that we do. Mm-hmm. And when we look at it in such a way, you can see now that there's a division between legalities and morality.
Yeah.
And until we can run this world based on moral principles, I mean, that was Bob Marley's dream, running the world based on morality and not laws and rules.
Yeah.
I need to understand what changes in my medical care state to state to state. Why I have to get a state license everywhere I go to different states. $3,000-$4,000 it costs me.
Is it just another element to try and control you, or is it just a money game?
It's a money game,
okay.
And it's sad, and but every money game is in essence a way to control you.
Yeah.
Because then there's always little avenues where they can pull the plug on you.
Yep.
And nowadays in medicine...
we saw that in COVID all the time. Any doctors that pushed back against what was the mainstream narrative, they're losing their licenses.
You better not say the wrong thing anymore in the land of the free.
Well, because I know a lot of times when people are pushing back against the narrative, we talked about it yesterday again. We should have just had a podcast going on when we were talking. But it's like... if you're not a doctor, you can't even have an opinion on something. Like when I would push back on things that just intuitively feel off, my inbox would be filled up with people saying, you're not a doctor. But you are, and correct me if I'm wrong, you're professionally trained as a cardiac anesthesiologist?
Yep. Anesthesiology, pain management, osteopathic medicine. So I've been board certified in each one of those categories.
So then you saw, like you just said, you started seeing the writing on the wall for things not making sense, literally as a medical student, but then you ended up taking a deep dive into that world. So what was that journey like?
Well, when I first got into school, I did it because I hurt my back in college. I was a mover, and it was my summer job. And I was in school. I was an economics major my first year in college. And when I hurt my back, I had pain down my leg, and I didn't really have back pain. I had some back stiffness, but I had this horrible pain on the outside of my right calf. So I went to my family doctor. Oh, knee pain, go see an orthopedic surgeon. Orthopedic surgeon, oh, knee pain, go get an MRI. MRI, oh, get set up, we're going to go do a scope. I go to the physical therapist before the scope, and he lifts my leg up on the table, and I was like, woo, like it was tight in my back, and he goes, buddy, it's not your knee. You have a pinched nerve in your back sending pain to your knee. So I'm like, dude, you're brilliant. Go to the orthopedic surgeon. This is what the physical therapist says. He sent me for an MRI, got me an MRI, showed a herniated disc, took me to surgery, and had his resident operate on the wrong level of my spine. So I came out of surgery with back pain and leg pain. And I was like, and he's like, oh, we got to do, and I'm like, you guys aren't touching me anymore. So I was in college, I was an economics major, and I was depressed. They were giving me pain pills. I was getting fat. I was an athlete my whole life.
How old were you when this happened?
18.
Okay.
So I looked in the mirror and I was about 15 pounds overweight. I couldn't see the squares on my belly, and I was like, I was state cross-country champ for freshman year in high school, and now look at me.
Yeah.
So I went to Kmart. They still had Kmart at the time. And I bought a chin-up bar, and I put it in my bathroom wall because I had a little studio apartment. And I put my feet up on a chair, and I could do 2 or 3 assisted chin-ups. And that turned into 20 chin-ups 3-4 times a day within a year. Within a year and a half, I used to get on the bus, and I would sit down, and I would push myself into a position where I pushed my legs against the chair in front of me, and my leg pain would stop. And one day I sat down, I was like, wait a minute, I don't have leg pain. What changed? I said, I got into shape.
Yeah.
So I got this epiphany. I should be a doctor. If these morons don't know how to fix my back pain, and I can figure it out through exercise. And then I realized, oh, they do know.
They're just withholding.
But a patient fixed is a client lost.
Yeah.
And then I got into the understanding of how these companies were coming in and manipulating physicians, saying, we're not practicing medicine, we're just not going to pay you unless you practice the way that we say.
So you had an understanding of kind of the corruption of the system before you even got into it.
I got into it right at I would say, the verge of the corruption, where they were going out buying lunches for groups of residents at a time, taking you out to steak dinners and just implanting in your head, you'll never make more than $150,000 a year, so why be a specialist? Mm-hmm. And I was like, you know what? God kind of pushed me into this arena by letting you losers F up on my back.
Yeah.
To the point where I took it under my control and was like, I have to lead the way to make other people heal.
Wow.
And I first got into it to be a neurosurgeon. And I got into the internship and everything. And basically, during my internship, I realized that a neurosurgeon basically takes care of 3/4 dead people. Mm-hmm. And they really aren't making an improvement. And they started dabbling into spine. And when they dabble into spine, they have a business plan. Operate a little bit here. We'll bring you back, operate again. Like they can do 4 or 5 surgeries off of what an orthopedic surgeon would walk in and look like a carpenter, and he would rebuild your spine. However, he would do a lot of change, and the adjacent segments would break down within 4 or 5 years above the fusion or whatever you had.
So is that because if you fuse one area, another area is inevitably going to start holding that stress differently?
Correct. Most people that get a spine fusion, 1 or 2 levels, don't notice too much restriction because their pain's better.
Yeah.
But the levels directly adjacent get about 4 or 5 times more activity and damage.
One of my black belts had a fake disc put in about 2 years ago, and he's going back this weekend to have another one put in right above it. Mm-hmm. So that supports exactly what you're saying. Mm-hmm. Man.
So when I looked at the fact that there's a business model in medicine, it shouldn't be. We take an oath to do no harm. Mm-hmm. That I took very seriously. And my thoughts were, why don't we just fix people and be known as healers rather than medical managers?
Yeah.
And until I figure out what synthetic pharmaceutical I'm at deficit for in my body, why do I want to put that in my body? Mm-hmm. So then I even got delved into sun gazing, grounding, all of that kind of stuff. And there's a Dr. Cruz that's a neurosurgeon that actually describes the actual biochemical reaction that occurs when you ground and stare into the sun at the latitude of the earth that you're at. You will feed instantaneously all the mitochondria in your body electrons from the earth by being barefoot. And then by gazing at the sun, that triggers a cascade of activity, basically a light show within your bacteria, your microbiome inside your gut, and they make your vitamins based off of the time of year and where you are.
Actually, since again we talked about it yesterday, I did that this morning. I woke up at about 7, went out in the lawn. I watered the lawn down so my feet would be wet, better conductivity. and then stared at the sun.
Yeah. And at first when you do it, your eyes will tear.
Yes.
And they tear because we're loaded with yeast. And that's going to start to kill the yeast. It's kind of interesting because the bacteria will outcompete the yeast in your body.
Wow.
The good bacteria.
And grounding, sun gazing, all this stuff is starting to make a comeback. But yesterday was the first time I heard about doing them together.
Well, you know the Sphinx.
Mm-hmm.
The Sphinx has been a statue on top of a statue on top of a building.
Mm-hmm.
And the format that the Sphinx is in, with the forearms and the shins on the ground staring at the east, that's exactly the position to maximize the right amount of electron transfer from the planet.
Our neighbors just moved out, so we're going to get new neighbors here any day.
Mm-hmm.
They're going to see me out my backyard doing that. Another thing that I was told that this would happen, and sure as shit it did. I stopped wearing sunglasses about a year ago, and I haven't been sunburned since.
100%. And a lot of your system, because of the trigger of vitamins in your body based off of you looking at the sun in indirect sunlight, sunglasses make you depressed. Period.
Oh.
You build the greatest amount of lithium in your body, which is an antidepressant, through staring at indirect sun, specifically sunset.
Uh-huh.
So people that like sunsets are generally sad. And people that like sunrises are go-getter. Let's go.
Wow.
It's kind of interesting. And I don't know if one affects the other or if it's just kind of how we are. Or
Yeah. Man, that is interesting because you can also tie in, like, typically they say motivated people are up in the morning, and it's like there's always a correlation. If you're a high achiever, you're waking up early, but it may have nothing to do other than getting that sun in early, huh?
Possibly, but the sun triggers our cortisol levels, which are our anti-stress. And to have normal cortisol levels and a cortisol surge at 6 a.m.,
Okay.
all men have that. Men that have low testosterone, men that have other problems physiologically, aren't in sync with the earth.
Okay.
And their biorhythms are off, so that their daily cortisol surges are not in sync, and they end up getting a spare tire because they have a flat cortisol for the whole day.
Okay.
They also correlated that with drinking coffee after 12 o'clock in the afternoon can flatten your cortisol.
Really?
Yeah.
I just need we need to talk for just 10 hours. I know this is going to be a shorter episode, but I'm excited to already have follow-on ones because there's so much knowledge that you have, but it's also backed in. Our society today wants to have people that are clinically and professionally trained that can really unpack this on an expert level. And when I met you yesterday, I was like, dude, you're the guy for the podcast. Like, we could do this multiple times a year because all of these things are people have been kind of intuitively moving towards. And now having people like yourself help us understand the why behind it. Is all of the, again, we talked about it briefly, but is that cortisol depletion, I guess you would call it? Or I guess it would be an increase in cortisol, would it?
Or a dysynchronization.
Dysynchronization.
Because even hormones, we need testosterone. Men, when they take exogenous testosterone, have a very smooth bell curve.
Mm-hmm.
Okay? Regular, normal, healthy men spike. You get upset, you spike testosterone. You get hungry, you spike testosterone. Somebody says something, you're afraid, you spike it. You have generalized levels, but it does this.
And that's all day, every day.
That's normal men.
Okay.
Once you take it, you instantly stop your body from doing those spikes. So you flatten it. So even though men look healthier,
yeah,
they're not quite. And the first reason I noticed that was I used to do PRP 20 years ago. I was always afraid of cord blood. Mm-hmm. I never could trust where it was coming from. I also know that the FDA plays tricks on 2%. And I need to know that a crushed up, murdered baby is
not part of your health protocols.
Different, yes, than cord blood. Explain to me the difference, because they're basically the same.
Yeah.
So once
are a lot of avenues of people receiving like PRP or stem cells, there is a correlation with aborted fetuses.
I'm worried of cord blood because of 2012, they actually made it legal.
Oh.
And they actually were like, it's within 2% difference. Now there's a little bit of pushback. I've been, I would say, dark completely from the internet since around 2009, 2010.
Okay.
And I just stopped trusting everything that I saw on the news. I saw a couple of things that were blatant lies even about me. And I really felt like, I wake up in the morning and I pray to help people get better. And when you're getting attacked by your own government that should be there to protect you, or your own American Medical Association that should be there to protect you, but they're not, they're there to protect the integrity of the business.
Well, so you go through medical school, you become, I'm assuming, like residency, then you become a, what's it called after residency?
You specialize.
Okay. And you become an anesthesiologist. Even through that process, you already had an understanding of how big pharma and the medical industry as a whole is working. What was kind of the straw that broke the camel's back when they're like, you know what, we don't want anything to do with you anymore, Brian? Probably multiple things, huh?
I patented stem cell nebulization.
Oh, okay.
And when I did, I was pretty much attacked pretty quickly from every other angle to discredit me. And it emotionally hit me. I got a divorce because I had somebody that casted doubt on what I was doing, and I basically was like, I'm on a mission here. I didn't care what happened around me, except to my children. But I knew that I was placed on this planet to actually make healthcare better, to make it logical again. I need to explain to you, when you go into a hospital, everybody gets an IV bag, right? Mm-hmm. And we all know that being alkaline is much healthier than being acidic. Acidic is where disease runs in our body rampantly. Sodium chloride is your average IV bag. Salt is a preservative. Sodium chloride on its own is a preservative. They put hydrochloric acid to balance the pH down to about 4.5 to 5. On every bag of saline that every cancer patient gets, that every hernia patient gets. In your hospital, the bag of IV fluids is acidic.
And what was it prior to that pH-wise?
It should be 7.4.
Okay.
That's the human body.
The body. Yeah.
So why are you putting soda pop, basically, is the same thing as running a basically sodium chloride IV. It's bizarre, but every single thing in medicine is subtly based through the pharmaceutical industry to harm you.
So that's what I was going to ask you. Is this being driven by a nefarious agenda, or is it being driven by simply, well, I guess these two things aren't mutually exclusive, keeping people sick for money?
Yeah. Okay. Well, you think that there's like one main antichrist in charge of all of the evil that's going on in the medical world. But there's basically almost like an evil way of thinking. Mm-hmm. And you can notice it in people, and usually what happens is they get very staunch and they're not listening to what you say and they speak over you. And in the medical industry, money is what talks, because they made all the physicians hungry. They're the highest trained individuals on the planet, and we now made them struggle to make a living. Mm-hmm. So they threw a bone at them. Here's a vaccine to give everybody. We're going to pay you more than we've ever paid anybody for a shot. Your average family practice doctor would make $1,000 a day, $250,000 a year on average. He's got to pay his student loan off, which is probably about $150,000 to $250,000. He's barely scraping by a living. Now you give him the chance to make, on average, $700 per vaccine shot. You think he's going to notice problems? He's making more money in a month than he would usually make in a year.
And where did that, what was the inception of, I mean, is that just from the government saying, hey?
Remember Ronald Reagan saying the scariest thing you can ever hear is, I'm from the government and I'm here to help?
Yeah.
Okay, this is truth. What the hell was our president doing talking medicine to the American people?
Yeah.
And what the hell was he doing having a non-practicing physician in charge of all of this stuff. And then how do you have somebody who's a government employee have their name on a patent? That's my employee.
Yeah.
Patent should be patent owned by the U.S. population. Government doesn't own shit. We own the government.
I say that all the time about when they try and regulate the mountains and the ocean and even the roads. Even the roads, it pisses me off because people are like, the government made the roads, so driving's not a right, it's a privilege. And it's like, no. We paid for those. We collaborated our money, and the government was just basically, they were just entrusted to oversee the project.
There's a show on Prime Video that's called Joe Pickett, and he's a Wyoming game warden. And there's one episode in the show he walks up on this guy who's fly fishing, and the guy's a mountain man. And the one hint that he should have left this guy alone was when the guy caught a trout, he bit the head off the trout and threw the trout in his bag, spit the head out. Well, he basically tells the guy, how many fish you got? He goes, probably 10. He goes, well, the limit's 6. And he goes, yeah, whatever, I don't care. Why, do you own the fish?
Yeah.
He goes, well, I'm here to protect the fish. And he goes, well, I have a problem with that. And he goes, well, you can bring it up with the judge. And he goes, do you and the judge happen to get your paychecks from the same place? He says, I think you're the criminal here, not me. And I was like, wait a minute.
Yeah.
You're describing medicine. You're describing insurance companies. You're describing the FDA.
Yeah.
And wait, all these people get their paychecks from the same place. That's us.
Yep.
Yet they turned on us.
And then, we pay them to subjugate and control us.
But they don't.
Could there
and
be
they
a more corrupt system?
They call themselves our leaders now.
Yeah.
They should be called the bitches.
Yeah. We just became,
no offense.
Hey, we just became best friends,
Yeah, okay.
whether you know that or not. So then, once you started, or was it after you got the patent for the how do you phrase that again? Nebulization of stem cells?
Yep.
That's when they went on the attack, huh? Is it because they know that you will be able to help people, or is it because they can't control that? Because, like you said, they can't patent the proteins.
I disclosed to the FDA that I had a number of patients that had COPD. They took a pulmonary function test. They did my treatment. They took a pulmonary function test 2 weeks later and didn't have COPD. According to that, that's considered fraud because the American Medical Association believes that there is no cure for COPD. So my statement was, I'm going to put the steroid industry out of business for respiratory disorders, because we can fix respiratory disorders with specific regenerative materials that you breathe in. And this got some attention, but they hit me from different angles. They started saying that I was basically charging too much for service. Dude, if I charge $1 million to change your tires, that's not fraud if I change your tires.
Yeah, and people can accept
that's called
or
supplier
refuse
demand.
It. Yeah.
Right. So they came after me with the angle where we're going to have most of the 8th grade educated Americans sit on a panel and basically see your house, your pool, your cars. It doesn't matter what it is, they're not going to like you.
Yeah.
So we're going to make you an example.
Paint you into a villain because you've earned.
By definition, if you know of a felony and you go to threaten somebody, I'm going to tell on your felony unless you give me $1 million. That's extortion. But the government's allowed to do that.
Of course, the government extorts everybody.
So how is that legal? These people are fucking criminals. Am I allowed to say that?
Bro, we can talk about stringing their asses up too. I don't hold back because, again, we talked about, I don't have fear of these people. I know what it's like to fight other men to the death. I know what it's like to partake in activity you don't think you're going to see the next morning. Like,
problem is these guys, the CIA and the mob, they don't murder you in a way that you look like you're murdered. They get a busboy to go into your restaurant, and they put some arsenic in your food or some cyanide in your food, and you have a flat-out heart attack right there during dinner. Same thing that they did to the guy that patented a water engine making hydrogen through putting electricity through water, could drive his car on 2 gallons of water coast to coast. Went out to dinner, started screaming, they poisoned me, dropped dead in the parking lot. They don't have books written on these things.
Yeah.
And if they do, they're not being published. Just like nobody wanted to publish my research.
Yeah. Well, that's it's a dawn of a new time.
Mm-hmm.
People are opening their eyes. They're starting to see what's happening, and people like yourself are pushing back and moving forward with your mission regardless. And they can try and stop it, but
we talked about the Bible's not full of stories of pussies sitting around letting bad people do bad things.
That's right. That's right.
It's full of good people actually resorting to violence in order to stop the evil.
That's right.
That's sad, but that's the truth.
That's the truth. And you know, while we were talking about that, we were saying like we have somehow been neutered to the point where like one thing that you always hear is violence not the answer. Violence isn't the answer unless you're on their team.
Well, you can just call it a peaceful protest.
Yeah, that's right. We can hold a sign that says, I don't like what you're doing to me. Meanwhile, they're extorting us from our money. They're making us sick. And if you push back against them, you end up in a cage. Mm-hmm. So violence is certainly the answer on this side of the house. But over here, you have the right of a peaceful protest. It's like, you know what, dude? I'll show you what a peaceful protest looks like. And it won't look like January 6th.
I needed somebody to explain to me why it was okay to go to Costco, but it wasn't okay to go to church.
Of course. And there's a million examples of that. Those motherfuckers, man.
Oh, I was at a casino in Vegas one time. So at first I got thrown out of 3 casinos as soon because I was refusing to wear the mask. I'm like, I'm a surgeon. This is a spit guard, a fucking spit guard. If you actually think it's protecting your respiratory system from this, first off, you're wrong because it's increasing the heat inside your sinuses. So you're actually making things incubate in your mouth, inside, and then you're spitting bacteria onto that diaper, basically. They're reproducing without your saliva actually disrupting it because your saliva kills a certain amount of bacteria in your mouth. And then you're breathing in their waste all day long. So after 2 hours, your average surgeon changes his mask. Mm-hmm. And then they had these spit guards. People were wearing them for weeks at a time. So I go back to the bird flu epidemic, 1911. There was a higher incidence of people dying wearing their face masks than not. Fresh air is antibiotic.
Who would have thought?
Ocean air is antibiotic.
The woods.
Yep.
Yeah.
Yeah. Period. So now I'm going to run in a trail in Vegas on a forest preserve, and they have a ranger there telling me to put my mask on.
See, dude, so if I say something, you're not a doctor. But then the other side of the coin is security guards at the door of Costco and park rangers are actually telling a doctor what to do. Mm-hmm. It's like,
so this was
can't
funny.
have it
It was
ways.
You were saying that not being a doctor, nobody listened to you. Imagine being a board certified doctor.
And they don't, yeah.
And like last week, you were paying me $1,000 an hour for my opinion. Now it doesn't mean shit.
And now the guy at the Costco front door knows more than you.
So, officers wearing a gun, me wearing a gun, I'm concealed carry. Wearing a face mask and carrying a gun is a class 4 felony federally. Right? So, like, how are this is like it's like actual laws were broken to make a mandate. In you know, I don't date men, so I didn't really understand why I had to listen to a mandate. So, but the whole problem is that. What is that? A lie told 1,000 times becomes the truth.
Yeah.
What was that? The marketing man for Hitler. Mm-hmm. And this is what we lived through.
That's nuts,
and
man.
People completely forgot Nuremberg trials. You understand? Nobody can force you to take a medical procedure anywhere on the planet unless you want to.
Yeah.
But here you have to take this vaccine. Oh wait, isn't that a medical procedure? Well. They should all be lined up and executed. That's
agree.
the rule. That's the law.
100%.
That's high treason.
And I will be the guy. I will be the guy to kick the stool out from underneath them.
Hey, I'm pain management, which means I can alter it one way or the other. Give me 15 minutes before you check them out.
Well, again, since we don't have a lot of time today, I would love for you to unpack what we just went through. You did a treatment on my elbow that's been acting up for a while. Then I did do the nebulizer, because a lot of people that listen to this show, we talk about preparedness, capability, physical fitness, jiu-jitsu, just overall approach. And taking care of your body is kind of the foundation of that.
I guess focus that I have as soon as I meet somebody is, no matter what the disease process is, we are magical beings. If I put you in balance, you will fix your disease process. That's all I focus on doing. So I have to identify what part of your body's out of balance: sleep, relationship, health, like diet, whatever it is, activity. And then I look at you and I say, okay, there are certain things that we need to do that I can shortcut. Your stem cells are just fine in your body. There's no such thing as a genetic defect. People with genetic defects can't live past 6 years old. I did open heart surgery as an anesthesiologist on hundreds of babies that had true genetic defects. They don't live long. Most of them only live a few months. When your heart is created on the outside of your chest wall, or your stomach is outside, and you've disconnected with your esophagus, and you've got... These people don't live very long. So to say that cancer is a genetic disorder where there's a switch of an oncogene that goes off and on, what bullshit, okay? We all are the same car. We just do different maintenance, different oil, different gasoline, different, like everything that we do, they ride them differently. We're the same machine, just treated differently, so we break down, and there's only one disease process: inflammation. Once you get inflammation that's ignored and it becomes an acidic background, then all kinds of things can grow inside that acidic environment. So when I started delving into stem cells, I used PRP, which is the platelet-rich plasma from your blood, where you concentrate white blood cells more than 7 times, and they release growth factor and anti-tumor factor, and they actually facilitate healing. Well, everybody wanted to use cord blood, and they started talking about live cells and mesenchymal cells and all this, and I kept wondering, if I put an architect from a building that has that plans into somebody else's building, just because you have a set of plans which is like DNA doesn't mean you can fix every building. So I always wondered, well, is it really the cell fixing? Because if I inject somebody else's cell into your meniscus that has a tear in your knee, we tell this story that that cell is going to find itself into the crack and replicate itself and make like a bridge or a patch of new material, which doesn't happen at all. If that occurred, you would have a rejection against that piece of patch every day for the rest of your life, because the outer membrane of that cell has a fingerprint on it that's unique to the individual that it was made for.
And you
it's
even
called
said
HLA.
Even identical twins.
Even identical twins have different HLA.
Okay.
So that stem cell that goes into your body, here's your stem cell in your meniscus, and your stem cell in your meniscus is an architect that's looking for workers, tools, and materials to fix that scaffolding. So what it does, it releases inflammatory chemicals that dilate your blood vessels. Those blood vessels now are more likely to bring more nutrients there and wash away more junk that shouldn't be there. But when I stick your twin brother's stem cell or a bone marrow cell into your knee, your architect communicates with the foreign architect put in there, and it reads your inflammatory message and releases exosome packets in answer. That pretty quickly calms down the inflammatory aspect of your knee, but the rebuilding of your knee doesn't occur until more exosome comes, and that comes at day 3 to day 7, when your white blood cells in your system get wise to that foreign stem cell in your body, and they attack it and they pop it open. When they pop it open, all of the workers, tools, materials are released, like stem cell juice. The DNA is cleared, the membrane is cleared through your white blood cells in a process called phagocytosis. Then the products, with enzymes as well, create a system where your stem cell either has to shit or get off the pot. It has to work right, or it has to die and let a new one replace, and that exosomal material triggers it.
Okay.
So
it's your own stem cells.
Your own stem cells
regeneration of tissue.
Yep, they're architecturally, I'd say, conducting the healing And all they use those foreign injected stem cells for is the juice.
Okay.
And that activity of 3 to 7 days where they pop open the foreign stem cells, that's rejection. And when rejection occurs, it ties up your immune system. When it ties up your immune system, it may have limited resources and take your immune system off of guarding another process that hasn't quite manifested, like cancer, like an infection. All kinds of things like that can run rampant when your body is rejecting those stem cells, fixing your knee. That's why they say.
So you get a tear in your meniscus and shoot somebody else's stem cells. The other side of that is a cancer in an unrelated part of your body may actually start thriving.
Correct.
Wow.
Correct. So back in the day, I had brothers come in and say, can't you use his PRP for my knee? And they'd say, well, let's test your blood. If your blood is compatible where I can give you a transfusion, I'm going to take your brother's PRP. I'm going to mix it down. Then I'm going to put it in my cryo freezer at 80 degrees below 0 Celsius. And then I'm going to thaw them because your cell membrane is broken. And I'm going to have stem cell juice, and I'm going to inject them through a series of filters. So I have needle filters that I can go syringe to syringe to syringe with all the way down to 0.22, which is scientifically considered sterile because a bacteria is bigger than 0.22 microns. Okay. So we injected that stuff into people from one relative to another, and they did great, but it didn't really last long. So I needed something that was a little more of an oomph. Okay.
Were the cells still fully intact?
There was nothing
that process
other than
breaks them apart.
Completely breaks them apart.
Okay.
And basically gives you exosome.
Got it.
From your twin brother. Okay. Mm-hmm. Or whatever relative it is, or somebody who's compatible with you. But I was only injecting that directly intravenous because people wanted intravenous at that point in time. And if I could get a month reaction from amniotic fluid product, I could get a 2-week reaction from this. So then I started delving into injecting it because one of my friends came by my office because the first thing that we did was first time I ever used PRP was in the spine. Mm-hmm. So I had talked to him about learning how to mix PRP from the open heart room, and a couple of the surgeons were using that as tricks to put into the blood vessels so that it would last long before you transplanted the saphenous vein as the bypass graft. And it helped with the integrity of the implant. It helped with the bypass, and it helped with the incision because that sternal incision is a big deal to heal. Well, my friend was a radiologist, and he was watching me do injections as a pain management doctor with steroid and Novocaine. He says, there's a guy down the street injecting this PRP stuff into diabetic ulcers. What'll happen if you inject it into the spine? This is like 2001. So I was like, buddy, you're brilliant. We inject whole blood into the spine when you get like a spinal tap and you have a headache from that. This is even safer. Mm-hmm. So I started injecting into the spine, and we started having people get better and stay better.
Wow.
So then I built a gym.
What type of injuries to the spine were you finding?
Herniated discs, arthritis, just about anything, even compression fractures. So they have a technique where you put cement and you can correct the kyphotic deformity of a bone because your bones in the front break down, but your knuckle joints in the back stay stable. Mm-hmm. So you kink forward whenever you have a compression fracture in your spine.
Well, so something that jiu-jitsu athletes deal with all the time are compression injuries, herniated disc, bulging disc, and you found that this resolves that, huh?
It substantially speeds up the healing process, makes your bone fuse faster than 6 weeks. The downside with a compression fracture is it doesn't fix the deformity.
Okay.
But it makes the pain better.
Okay.
And it takes all of the nutrients in your body that you use to actually heal an area and concentrates them.
Okay.
Which is more than you can do by dilating your blood vessels. So that was the initial step into it. And then I had an office manager that was taking anti-rheumatoid medicine, and I gave her pulmonary fibrosis. They say that's a small percentage of people, but it's on a black box warning. And when she went in to fix her wrist pain, she was given a drug that basically shortened her life. at that point in time, I kept thinking, how can I get this PRP stuff into her lungs? So I'm a certified bronchoscopist as well as part of my anesthesia training for emergency intubation using a bronchoscope. So I'm thinking, what if I just use the injection port? I just imagine her brittle lungs bleeding all over the place I'm trying to inject, and I'm like, I'll make a problem worse. So then I thought, I'm going to nebulize this stuff. So I took her out of the back of my surgery center, and I mixed up her PRP, and I put it in a regular asthma nebulizer.
Which are the things you get at Walgreens.
Yeah.
Yeah.
And it made a huge difference right away. However, my head nurse came out of the surgery center, saw this big red cloud of her blood and mist around her, and said, oh, you can fix her disease, but the EPA is going to put you in jail. And I went, oh, shit. So half a bottle of wine, some duct tape, and the circuit for a ventilator. I cut up and made the unique circuit that I submitted it for a patent at the U.S. Patent Office, and I got it. And I got not only the patent for the device itself for stem cell nebulization, I patented the entire process of taking your blood and amniotic fluid and nebulizing it.
Okay.
And
well, and I was actually just sitting here thinking, because I mean, I did that, an hour ago, and I feel like I can breathe, like my lungs are bigger. Is that normal?
Yeah, and actually I stopped wearing glasses after the fourth or fifth time I did it.
Are you serious?
And I honestly feel like I get smarter every time I do it.
Dude.
It's kind of...
Well, and that's one thing you said yesterday is like the beautiful thing about nebulizing stem cells or exosomes, however you want to phrase it, is that as opposed to locally treating an injury, your body kind of intuitively puts it wherever it needs it most. Huh?
Within a couple of breaths, it's in your cerebrospinal fluid, it's in your heart, it's in your lungs, and then it goes to your liver. When I give it to you intravenous, your liver needs it, but it'll instantly go to your liver, and your liver will kind of hog it. Well, you still live longer if your liver gets improved, but what I do, if I have whole body problems, I may give a tenth of the dose intravenous. Your liver starts a cascade, and then it starts to fix itself. And then the next day I give you a bigger dose intravenous.
I see. So the liver's satisfied at that point.
However, I have amazing results. I do different pathways of injections that I explained to you earlier if I'm targeting certain organs. Once you understand the anatomy, you can actually target a venous injection to go to the area or the organ system that you're looking for.
Oh, I guess that makes sense because that's where it's going to be affected first. Okay.
And it just kind of, your body doesn't really uptake an excess of anything. You release every excess of anything. And I also think that there's a weird, you know when you take like 6 pool balls together and you hit the one end with the cue and the other one releases?
Yep.
Sometimes I feel like your body does that cellularly. I can't actually prove that, but I can give stem cells in one arena and the excess cascades and releases where you need it. Like it allows your cells to share better.
What are some examples that listeners would just be like, holy shit, like things that even surprise you as you treated different patients?
The biggest thing that surprised me is the positive effect that I have on post-stroke patients.
Okay.
I had a couple of patients that had head injuries, and they were doing the breathing treatment for COPD, smoking disorder, and allergies. And they would come back every 6 months telling me that they felt smarter. And one guy had the first time I ever met him, he had a brain disorder that would let him speak almost like a verbal salad is what it's called, because he could have 3 simultaneous conversations coming out, alternating words at the same time.
Oh, so super easy to interpret.
Like you totally couldn't understand anything he was talking about. In the second visit, you could understand him. Third visit, he was actually
conversating.
Yes.
Wow.
And he was the person that when I went and treated a group of special forces dudes, one of them, somebody called me up and said, here's a bunch of money, go treat these 10 guys, they're my brothers. So when I treated them, he gave me a lot more money than I needed to treat these guys. So I said, I'm here for 3 more days, call your family, friends, your sisters, whoever.
Hooking them all
just
up.
come on in here. So one of the guys
Where were you
said,
at? Can you say where you're at?
I was in
Okay.
undisclosed location.
I got
Okay,
it.
I'm sorry. And So one of the guys said, my mom's in a nursing home. She's had a stroke, and she hasn't spoken to us. She's in diapers. She's getting bed sores. I need to know if there's anything we can do. And I said, look, I'll try. So we basically went and acted like the family prayer guide. And I invited all the nurses to come into the room, and none of them wanted to come into the room. So I said, leave us be for a half hour. We quickly slapped the nebulizer on her. 4 hours later, she was sitting up, combing her hair, asking to call her sister.
Whoa, dude, I got chills from that, dude.
If I explain to you, we also made her diabetes better. I don't know, because she started acting again or whatever, but she kept slipping into a coma the next night. So 3-4 nights in a row. I call up basically the medical director, and I said, hey, I think you're overdosing her on insulin. They wouldn't change the insulin dose.
Oh, it changed her insulin sensitivity.
They wouldn't change
but they
her
wouldn't
dose.
change it.
They kept putting her into a diabetic coma every, a hypoglycemic coma.
So within a day or two, her insulin sensitivity changed.
Yes, and actually we had to, I told the guy that paid for the whole treatment, I go, we have to take this lady out of the hospital before they kill her. So he sent us a jet, he sent us a big fat limo bus, and my assistant is a Venezuelan bodybuilder, so we went upstairs, unhooked her IVs,
He carried her ass down.
carried her outside, got into the van, and they moved to Vegas so that we could treat them.
Wow.
Yeah, and she lived about 5 years and unfortunately passed away after.
Yeah, but still, I mean, the quality of life was
We
changed.
only did one treatment on her.
Was changed in one day.
Yeah, she actually got respect,
Uh-huh.
her own self-respect back, and
Yeah.
I mean, just imagine leaving the world with somebody else wiping your ass.
I know, dude. I know.
Yeah.
So fascinating. And you're the perfect guy for the mission because you're willing to push back, you're willing to stand up, you're willing to speak out. That's something that was really frustrating for not only me, myself, but like most people that were outside of the medical community. You would see doctors very similar to police officers. Like I lived through this in my profession, and I'm sure it's the same thing where like behind closed doors, everybody's like, yeah, that's bullshit. I wouldn't do this. I'm not going to do that. And then where the rubber meets the road, it's like everybody crumbles.
Yeah.
And people are starved for physicians that are actually living an ethical life and doing the right thing.
People have more respect for money than ethics and morality.
Yeah.
That's what's sad.
Yeah.
That's what's sad. So there was a story I think we talked about the other day of Stalin walked into his boardroom, had a chicken on his lap, and he's petting the chicken. And his board members say, hey, what's with the chicken? He's like, I just need to show you guys an example on how to treat people.
Nuts.
So basically, as soon as everybody sat down, got comfortable, he started viciously ripping the feathers off of this chicken, ends up throwing this bloody, bald mess on the floor. And he says, this is how you start. And then he grabbed in his pocket a couple of crackers, threw some crumbs on the floor. The chicken walked up to the crumbs, started eating them. Closer. Next thing you know, the chicken's in his lap. This little bald, bloody mess eating the crackers out of his hand. And he says, if you treat people like that, you can give them crackers and they'll be happy. That's what they did to medicine.
Yeah.
They slowly spent 20 years slowly degrading, starving, humiliating physicians, putting them on doing rack audits, all kinds of stuff to get the attention off of the government people that were stealing Medicare.
Mm-hmm.
So around, I don't know who did it. It was either Bush or Reagan basically said that you can use Medicare and Social Security funds for your political needs. None of these politicians pay back the money that they borrow.
Mm-hmm.
They basically deplete the funds, and then they send everybody fighting with each other, blaming each other, but they're the ones that took the money.
Yeah.
So Medicare isn't running out of money treating people. It's running out of money because the politicians are taking it.
Yeah. Shocking.
Yeah. And we even talked about politicians, and until we're with our armed guards around us, we should keep those conversations off the air.
Well, I'll put them on the air. I don't care. But no, obviously I know.
Just give me a Kevlar suit.
Yeah.
They make some nice ones too. I've seen the 3-piece suits for.
That's the thing, man. Like if we, at a minimum, like some people won't even have this conversation.
Yeah.
And they know that it's truth. But at a minimum, you have to at least be willing to shine a spotlight on it. Even if you don't want to be one of the people that actively pushes back, just the awareness of these things. And a person like you with your background and your expertise and what you were subjected to for simply pushing back against the narrative, do you know what that proves? That proves it's truth.
Yeah.
Because if, let's just say some of your modalities were kind of like, what the hell is he doing, right? If it's truly rooted in trying to make people healthy, at a minimum, they're going to come at you and be like, show me what you're doing. Show us what's going on. Help us understand. Mm-hmm. The fact that they just want to close the door on people like you, it corroborates what everybody is suspecting them of doing.
Back in the early 1900s, Henry Ford was the unfortunate soul that set precedents for everything that's evil in our business system that has slowly affected medicine.
Like the 40-hour work week?
So, exactly. Well, he, after a couple of years, Model T Ford was just doing better than he ever expected. So he gave every one of his employees a whole year's salary for Christmas bonus. Mm-hmm. He also had the only or one of the last Christian loan centers for any business ever, because according to Christianity, you're not supposed to loan for profit. It's called usury. Mm-hmm. This is why Jesus went and flipped the tables for the money changers and all this kind of stuff. So it's been proven that after about 4 to 5 generations, the money changers own 80% of the land. So this has been basically Christian laws. You're not supposed to loan for money. So you buy a Model T Ford for $500, you had 3 years to pay it off, the $500. When he gave his staff the year bonus, his investors sued the employees and him, got their money back, and set legal precedents that the board of directors and your shareholders are more important than the customer and your employees. Mm-hmm. And nobody has ever broken that since. So now you take any product on the market, anything, and it goes public, it'll never get better quality.
Wow.
Nothing will. Yeah. Legally, they have prevented that from occurring because you have to pay legally to your shareholders before you do your customers.
Now, what is the answer to all this? Is it just a fucking giant
Violence.
Comet?
I hate to say it.
Yeah.
Good people doing the right thing and not being afraid to do the right thing.
I feel like Mother Nature is going to intervene sooner or later and just be like, you know what?
God's going to come back, and when he does, it's not going to be... There's a lot of people that are going to have some issues. That river of fire and brimstone is...
Where are we at? Because I know you have to head to
hit the airport.
Yep.
It's about time.
It's 10 after 1, so you got to get running.
I do.
Okay. Well, dude, I really appreciate your time just sitting down. I know you're going to be moving forward on some different clinics and whatnot, and when we're ready to direct people to you and try and get the word out there that you're up, you're running, you're ready to treat people, I would love... I mean, my audience is starving for physicians like you.
Thank you.
And I would love to corroborate on whatever we can to help push your message, push your treatments, and start getting people healthy.
Right now, we're building a team.
Okay.
And the team is almost complete, and we have a lot of good players from a lot of different arenas. You're going to be involved in it quite a bit. You have quite an insight to what's going on and actually to what to do to improve medicine from your standpoint.
Yeah.
I have it from my standpoint. We have businessmen coming into this from their standpoint, because you need to make money, but you can't do it at the expense of anybody else.
Yeah.
So there really is a way to do this in such a way, even in nowadays values, I can probably keep the majority of people off of medicines, out of the hospitals, out of trouble for around $6 or $7 grand a year.
Yeah.
What's
your health worth?
What's your health insurance cost? About that much. So once we get somebody kind of involved in here,
or what's being perpetually sick costing you too?
Yeah, and if we have health care where it's health maintenance, like why do we only go to the doctor when we're sick? We should be going once a month, but he should be keeping us firing at all 8 cylinders.
Yeah.
We shouldn't be dragging our way. Oh, here's a pill. There's a side effect. Here's a pill for the side effect. Oh, great. Now I got you in for every month for the rest of your life.
Yeah. All right. Well, dude, I'm honored to. Okay, you can go say hi. I'm honored to be part of this. Thank you for bringing me on the team, and we'll be doing this many more times. We're getting together, podcasting, and sharing the good message. So
Thank you.
Appreciate you.
I'm excited.